A new report out Friday morning says the U.S. could see 75,000 more deaths of despair as a result of COVID-19. The report from mental health and physician advocacy groups, Wellbeing Trust, and the Robert Graham Center warns of, quote, a preventable surge of avoidable deaths from drugs, alcohol, and suicide.
It's not so much the virus that's going to kill us, though it will kill us, and sadly it is killing us. It's also the fact that we're losing our jobs, that we're socially isolated, we're lonely, we're disconnected.
The report breaks it down to the state and county level. Some states would fare better than others. New Mexico, Nevada, and Arizona have the highest projected death of despair rates. Data scientists looked at the Great Recession when rising unemployment and individual uncertainty led to increased deaths of despair. But they note some factors are different here.
It could be worse than 75,000 deaths. The isolation and uncertainty are two unknown factors in our model. There has not been an event in the world that's caused the level of isolation as this.
The models are just that, predictions. But advocates say that there are steps governments and care providers can take to help curb any increase of deaths of despair because of COVID-19.
Training a workforce that's tracking and tracing infections could be done, I think, very easily with something like mental health first aid, questions that a community member can ask another community member about how they're doing, and help them get care if they need it. It's a lay person, sort of a peer question.
We can now use certain platforms. So if you're an iPhone user, you can use FaceTime and talk to your therapist. That was not paid for or even allowed before because of privacy concerns. So we've loosened some of those restrictions. I can't imagine that some policymaker somewhere is all of a sudden just like, just kidding. You were able to talk to your therapist through FaceTime, now you can't, because it's so easy. And they don't require any money. They just require someone to ultimately change the privacy law or the regulation.
Lindsay Thies, Newsy, Denver.